All right, Dr. Richard Besser, former acting director of the CDC during H1N1, swine flu. Your resume goes on and on. It's a pleasure to have you right now. I want to talk about something that is extremely poignant right now. It's these nationwide protests, which have been going on in over 100 cities for more than the last 2 weeks. A lot of African Americans, many Latinos, many in minority groups throughout our country are part of these protests. Many are wearing masks, but quite frankly, many are not. And social distancing has been thrown out the window. It seems like African Americans and minority groups are extremely affected by coronavirus. First of all, why is that? And what can we do to prevent this from getting worse?
Yeah, it's a good question. The protests in the streets that are raising issues in terms of the experience of Black Americans with policing call up issues around racism. And when you look at the impact of the COVID pandemic across America, as you're saying, it's not hitting every community the same. We're seeing Black Americans, Latino Americans, Native Americans getting infected and having severe disease and dying at rates that far surpass their proportion in the population. There are a number of reasons for that. One is that very high proportion are essential workers. So when you think about, I feel very privileged. I'm able to work from home. I'm working remotely. I can protect myself and my family by doing that. But for millions of people in this country who live paycheck to paycheck, they're having to choose between going to work so they can put food on the table and pay the rent, or staying home so they can protect themselves, their families, and communities. And no one should have to make that choice. People of color have to make that choice more frequently. And
more often also, yeah, other groups, it seems like.
Exactly.
I've heard you talk about trust in interviews that you've given in the past, and open, transparent communication. As the former acting head of the CDC, obviously you've been apprised of information at a better clip than the majority of the population. I work in the media, so I'm in this stuff every single day. I hear from President Trump and the task force almost every day, or I certainly did when this was, a month ago. I hear from Andrew Cuomo every day in New York. I know you're in New Jersey. Why don't we hear from the CDC every single day in an impartial way, letting people know what's going on, where we are with the vaccine? Should we be wearing masks? Should we not be wearing masks? There's been a lot of mixed messaging. Yeah. We had it this week with the World Health Organization. And Dr. Besser, that's a problem.
Yeah, it's a big problem. One of the biggest tools you have in public health is trust and communication. And because we're not hearing from the CDC every day, we're not understanding what they're learning. We're not understanding why they recommended no masks before and recommend masks now. It's exactly because there's more science, there's more data, there's more information. When we look at,
do you think that costs lives? By the way,
what's that?
I don't mean to interrupt you, but do you think that costs lives? Telling the healthy not to wear masks 6 weeks ago, 8 weeks ago?
I think what's costing lives is not hearing from CDC every day in terms of what we should do. And I think what's costing lives and will cost lives going forward and will hit the same communities hardest is if we're not being driven by public health and the best public health recommendations, so that when people go back to work, lower income workers are going to have to go back to work sooner. And if we're not providing protective equipment, if we're not explaining to people why my wearing a mask helps protect you and you wearing a mask helps protect me, and that we're all in this together, if we're not making that case so that people feel it and it stops being this partisan thing, then people's lives are going to be lost that could be prevented.
Do you think the CDC during future pandemics will do something like that, address the public on a daily or weekly basis at the very least?
It's a political call. In every emergency response in my lifetime and going back, CDC has been there just about every day with that communication. And I found during swine flu in 2009, it was my most important tool. When I made a mistake, when we as an agency made a mistake, I could explain it and we could move forward. When we found out new information that led to a change in recommendations, we could explain it. So it didn't seem like we were wishy-washy or didn't know what we were doing. It seemed like we were learning and we were sharing and we were being open and we're in it together. And we're missing that right now.
Well, yeah, I mean, absolutely. If you look back at HIV in the early 1980s, the messaging from the Surgeon General in the US was that you can get it from kissing, from saliva. That was obviously wrong. But the point that I'm making is that we're constantly learning new things about these viruses, especially these novel viruses like coronavirus. And I think that not having that consistent message from somebody like the CDC. I mean, I'll tell you what, doctor, the next time we have a pandemic, hopefully we don't, but the next time we do, when I hear something from the World Health Organization, I don't know how seriously I'm going to take it as a journalist.
Well, you remember it wasn't that many years ago that the Zika virus was spreading and hit Florida really hard. Mm-hmm. Every day we heard from Ann Shook, the deputy director, and she told us about what we could do to protect ourselves. We learned more about mosquitoes than we ever thought we'd need to know. Right. But it helped us understand what we could do and why we were worried about this, and how people in Florida could take steps to protect their health, and it saved lives. We need to be hearing that now. You know, in Florida is not even collecting the information to be able to tell where the problems are and what groups are getting hit the hardest. And that needs to change so that lives can be protected.
I did read your op-ed in USA Today dated May the 5th. And May the 5th is eons ago now, with how quickly things are developing with coronavirus. People going out, ironically, the CDC is headquartered in Atlanta, Georgia, one of the first states to open, if not the first state to open en masse. People going out obviously means we're going to see an increase in cases. You have minority groups that are essential workers, like you said, and for whatever reasons, they're more susceptible, whether it's socioeconomic. It seems like if you make money and you're able to work from home, you might be able to weather the storm until we have a vaccine. What do you say to the 43 million people, and we just got the unemployment numbers this morning, what do you say to the 43 million people that have been sitting at home unemployed for 3 months?
Yeah. Well, you know, we want to get people back to work. And one of the things that really worries me is that public health is being put forward as the enemy of economic recovery, when in fact it's the roadmap. You know, if we do the things that public health is saying, so wearing masks, hand washing, staying home if you're sick, getting tested if you're having symptoms, if we ensure that everyone who's going back to work, that every industry has standards to protect their workers and reduce that risk, then we're going to be able to get more people back to work in a sustained fashion. You know, when you think about all of these measures of social distancing, they're tools that you dial up and you dial down. You know, South Korea, which has been doing really well with this, when they see a new outbreak or cluster, they dial up again on social distancing. And then when that's under control, they dial it down again. And it has to be seen that way, that we're collecting the information. People are getting back to work. When we see a problem, we're responding, you know, so that our healthcare system doesn't get overwhelmed like it was in so many different places. Public health is the way forward so that everyone in our communities can feel safe and protected.
If you had to assign a letter grade to the CDC with their handling of this crisis to date, what would you give it?
You know, I can't separate that out from the overall federal government, because CDC's hands have been tied for some of their most important tools. You know, and that shouldn't be. When I ran emergency preparedness and response, one of the big goals was to try and ensure that things didn't become partisan. And here with this response, with the CARES Act, that was passed with almost unanimous support from both parties. And that was terrific, because you need everyone to be all in on this. It has to be seen as a national effort. And what we're seeing when the messaging is coming from primarily political leaders, half the country will reject what's being said at face value. And that's a problem. We want things to be driven by public health and by science. It's not the only factor for sure, but you need to know what the science is saying so that as policies and recommendations are going forward, there's support from those from the entire country.
And that makes sense. Let me give you an analogy. We're in Florida. Let's say you went to a pool, Dr. Besser, and there was a sign that said "Swim at your own risk." If you knew how to swim, you'd probably go in the water, right? Let's say you didn't know how to swim and you went to that same pool and saw that same sign, you probably wouldn't go in the water. That, in many ways, is coronavirus. For people that are at an advanced age or have pre-existing conditions, maybe they can't go in the water right now. But for a vast majority of the country, as long as we are mitigating and taking the appropriate steps with regard to masks, isn't it time to get in the water?
Well, I like your analogy, but I think that one of the real challenges right now is that in so many parts of the country, you know, swim at your own risk. You need to know what that risk is. And to know what that risk is, you have to be collecting data. You have to be ensuring that testing is available everywhere. You have to be able to ensure that everyone who is tested positive or has had exposure has a safe place to isolate. And doing those things and keeping track of that data and being transparent about it will allow people to do more things. And so that if there is an increase, you'll pick it up quickly and you can take measures to stop it before it spreads. But if you're at that pool and people don't know what their risk is, some people are going to be going in that water who shouldn't be, and that's going to lead to a big problem.
Yeah, and that goes back to our messaging point. Emailed question that we got: public health funding and organization is never more important than during a pandemic, yet we've seen the CDC and WHO diminished, criticized, and quite frankly, insulted in the public sphere. It is an election year. We have an election in November. If President Trump or somebody else is elected, what can they do to change our current direction?
Wow. There are a number of things here. One is your point about the public health system. We support it greatly during a pandemic and usually for a year afterwards, and then the money dries up. And so, we've seen on the order of 60,000 positions in state and local public health that have dried up over the past 10 to 15 years. And those keep us healthy every day, and they're there to respond as well when there's a public health emergency. So we need to reinvest long-term, not just in national systems, but global, so you can pick these problems up elsewhere so they don't come to our shores. Then we have to fix our safety net so that everyone in America has health insurance. When you think about a crisis like this, 28 million Americans at the start of this didn't have health insurance. And given how many have it tied to their jobs, that number is just soaring. And so what happens when you think you have symptoms? Who do you call? What do you do? That leaves us all vulnerable, and that just shouldn't be.
Especially in the beginning. 12 weeks ago, this was a disaster to try to get tested and to try to get this figured out. I know that you know Dr. Anthony Fauci. He has become almost this revered figure in America. He's got his own bobblehead, Dr. Besser. Now, Dr. Fauci does.
You've made it when you've got a bobblehead.
Yeah, exactly. And Dr. Birx as well. The task force has operated under extremely difficult circumstances. How do you think they've done, and what can we learn from some of the mistakes that may have been made?
Well, I have to say in every public health emergency I was involved in swine flu, when I was leading CDC, I was standing side by side with Dr. Fauci. And he is a national treasure. But you also have to have standing next to him the head of the nation's jewel, the CDC, the nation and the global public health response agency. And it's different. And that's the piece we've been missing. Dr. Fauci is the expert in terms of treatment, in terms of the science of this virus, in terms of vaccines. But what you need on their side is somebody who is the expert on what can you do to protect your health? What are we learning? What can communities do? So that we're seeing both pieces of that.
Two quick ones, Doctor, and then I'm going to let you go. I know you have a very busy day. I want to date this so when it's on YouTube, people will know when we're speaking. It's June 11th. Right now, let me ask you this, and there has been some controversy over this, or at least it's been picked up by mainstream media sources. When do you think the first initial wave of this virus actually hit our shores here in the U.S.? Because right now we think it hit late February, early March when we first started seeing cases, but a lot of people disagree with that.
Yeah, I mean, there is some evidence that there were cases here before that. There were cases in January, and it's different to have a case versus transmission in community.
Right.
And so it's hard to say, and that's something over time I think we'll get a better handle on. But I think one of the messages is that with a new emerging infection, time really matters, and having systems in place so you can respond quickly, and having systems that will ensure that everyone in America is protected. I think that it is absolutely unacceptable and should be unacceptable that lower income Americans, Black Americans, Latino Americans, Native Americans are bearing such a disproportionate share of pain from this, not just from the pandemic itself, but from the economics as well. And we need to do better. And my hope is that moving forward, we as a nation can do better.
As of May 30th, African Americans with coronavirus are dying at 2.7% the rate of white Americans. That number is obviously way too high. Dr. Besser, pandemics have reshaped societies throughout history, throughout modern history, 100 years ago with the Spanish flu, in the 1950s with the Asian flu. Walk me through America, say, 5 years from now, 2025. What have we learned? What's changed?
Well, I think by 2025, I'm an optimist. I think we will have taken steps to repair our safety net and our social contract so that everyone in America has health insurance. Everyone in America has unemployment insurance. Everyone in America has a job that pays a wage so that you can take care of your family and save something for the future so that when there is a crisis, you can stay at home too. Everyone has sick leave and family medical leave. Right now, only about half of people in America have those things. Just addressing those issues would ensure that the next time there's a crisis, we do better. But it would also ensure that every day in America isn't a crisis for so many millions of people.
That's well said. Dr. Besser, thank you so much for your time. From all of us here at 10 Tampa Bay, CBS in the Tampa Bay area, we thank you for your time. Thank you. That was great.
Thank you very much.